Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Lafayette, Louisiana at Prather Chiropractic Services. Today we have with us a longtime patient, Mr. Jake Satig, who is a flight nurse, right? Flight nurse, and you've been a flight nurse for?
4 years.
4 years. Jake came to us initially about, 6 months ago? Jake, six,
Yeah,
7 months ago? About 6 months ago with sciatic pain, bilateral sciatic pain, which means pain going down both his legs that was radiating from his lower back. So we did an examination and we did x-rays on Jake. And Kathy, if you can zoom in on his x-rays, what we discovered was that Jake had a compressed disc down here between the L5 and S1 vertebrae. Here are the vertebral body segments of the lumbar spine. We can see a nice curvature here and good spacing between those vertebrae. But when a disc gets injured, it will start to dehydrate and lose its fluid content, and that causes a compressive type injury, causing nerve pressure and stuff in and around the nerve structures in that joint space. So we were able to do some adjustments on Jake's spine, uncompress that disc. And Jake, if you don't mind sharing with us what your results were with your treatment.
It took a couple months, and I was able to have less pain in my legs, less pain in my knees, and we started having muscle pain after that. So it was both vertebral problems and sciatic problems.
Right, and sciatic problems. And the muscle problems were, I think, your spine adopting this new configuration of movement. It's normal to have some soreness with a joint injury this old. You know, this is a normal disc. When they start to get compressed, that's usually a problem that's been there for a few years. And your body starts to get used to this new configuration of movement. Well, this old configuration, then we got to make it get new again. So get used to the new movement. And I think you've done well. What your symptoms today are from a 0 to 10, you were a 6 or a 7 when we started, and the pain down the legs, is it still there?
No, it's not there anymore.
No, it's not there. Now give, for our viewers who don't know what a flight nurse does, can you give a little bit of background on what your work entails?
So we're picking up patients on scenes and picking up patients from ICUs and ERs and transferring them from hospital to hospital. And whenever we're on scene, we pick up patients in awkward positions. There's very little chance that you can use an ergonomic lifting
strategy
because of the awkward positions that most people are in.
Are you dealing with dead weight, body boards?
Right. And most of it's flat on the ground, where you have to come all the way from flat on the ground to up.
Okay.
So you
on and off a helicopter.
And loading on and off of a helicopter.
Yes. Okay. Now, what company you work for?
I work for Air-Evac Life Team.
Air-Evac Life Team, and they're based out of
O'Fallon, Missouri.
O'Fallon, Missouri. So they cover a wide range. They'll cover a wide range.
Yeah, we have about 38 states that we're in.
That's tremendous. That's tremendous. So that's some intense work. Probably some very exciting work at times too. Huh?
Right.
Right. Now, as a nurse, as a healthcare professional, when you started experiencing this low back pain radiating down your legs, what made you choose chiropractic and coming to me and to us before maybe choosing some other route of intervention?
Well, I chose the least invasive route first, and if it needed to go further, I would go further. But I felt from working in the ICU and seeing spinal surgeries that once you go to surgery, you set yourself a new baseline, and that's about as good as it's going to get. Is whenever you fused, that's going to be as good as you get. The mobility is going to be restricted to that fusion. There's no chance of getting that full mobility back.
Yeah, and that's what we've seen. You know, when a joint does, and sometimes it is necessary if there's ligamentous instability, the disc is completely ruptured or desiccated, or what we call sequestered, where a piece breaks off. There's no ability for that joint to contain its movement, and then a fusion unfortunately is indicated. But what we know for a fact is that joint will never move right again. All right, what we try to do with chiropractic care is restore proper joint motion, because we know discs dehydrate and compress secondary to bad joint motion. Chiropractic adjustments correct the joint motion first. When surgery's done, that, like you said, the baseline is set, the joint is permanently fused, it's never gonna get any better. And what we can unfortunately see too is the joints above and below the fusion, their degeneration starts to accelerate. So people with spinal fusions, let me be clear, can still get chiropractic care. We work around the fusion and there's still some benefit there. But as a healthcare professional, Jake decided to try, hey, he's seen the results of surgery, he's seen the results of injections, he tried to do something non-invasive. So that's what we do here at Breakthrough Chiropractic. So what Jake's been on the biophysics table before, but he's never experienced those manual spinal neural decompression on the y-axis, the Ringdinger adjustment, which is key at decompressing, which specializes in decompressing the disc. It's the best adjustment in the world for decompressing the disc. So he's going to get that for the first time today, and we're eager to incorporate that into your routine. So you got any questions for me before we get started?
No.
All righty. All right, well, let's come over to the decompression table. All right, my man, we're gonna have you sit right here and then lay flat on your back. All right, let's go ahead and take that hat off. Show our viewers that you still got some hair in there, huh? All right, let's slide you down. All right, hands on the stomach here. Now, to put your spine in neutral, Drake, we're gonna elevate the legs.
Okay.
So keep your legs nice and relaxed as the table lifts. Key part of this adjustment is getting that spine in neutral and making sure the patient's in a perfect position to do this properly. All right, now we're going to stabilize the pelvis with these pins. It's going to be a tight squeeze, Jake, tighter than you think, and that's okay, it needs to be. Just breathe through the nose, let the pin sink. We're going right above the iliac crest. Okay, his reflexes are good there. Okay, we're gonna keep the back teeth touching. Breathe through the nose. And wiggle your left ear. Don't forget to breathe. Don't forget to breathe. Now that's why they call it a Ringdinger. Now Jake, you should have felt that go all the way down to the belt line.
Yes.
Ever been adjusted like that before?
No.
You felt a release down there at the L5?
Everywhere.
Been needing that. Look at that. Reflexes getting a little more lively. All right, finish cleaning up the neck. Very good. Tolerated that good, like expected. That gets to things that we can't get doing other adjustment procedures. A whole entire different vector of force going through that spine. Okay, come on up for me, buddy. All right, let's move you over to this table here. Go face down. All right, we've got the y-axis adjustment taken care of. Now we're going to work on the z-axis, pushing those vertebrae forward. This is working right on that L5, S1 joint complex, Jake's. Putting the movement back in that joint so that disc can start to rehydrate itself and keep itself hydrated. A spinal disc, hydrating itself through motion is a physiological process we call imbibition. And all chiropractors should know what that is, as it's completely pertinent to what we do in this office, okay? Completely the root of what we do to the joint. Great movement. See how all this is moving easier since we decompressed it? Roll your shoulders forward for me. There you go. Okay, good. Now we're going to work on the cervicals. Okay, roll on over for me. Face up. Okay, hands on the tummy. Okay, we're going to bring the head back over the shoulders. Okay, let's do the Jesus adjustment here. Now we want to get as much mechanoreceptor stimulation into Jake's cerebellum as we can to encourage his brain to tell the body to adopt this new configuration of movement. Very, very straightforward. Good. That's really good. Where'd you feel that one?
Right here in the hip.
Yeah. I felt it cavitate. Same thing here. You know what I really noticed today, Jake, is that this part of your adjustment went a lot better and we got more out of it.
I felt a lot more.
Yeah, since we decompressed you. Okay, hold up. Spin you this way. Let that arm dangle. Okay, good. Let that arm dangle. Okay, good. Good so far. Yeah, a lot of lifting, man. Some crunchy, some Rice Krispies in that elbow.
Mm-hmm.
Now, do y'all do any kind of, I mean, it's almost impossible to count for every situation, but any sort of ergonomic training with your work, safety classes? And
Yeah, I mean, of
sure,
course,
it's a tremendous amount.
it's gone over and it's encouraged, but you know, sometimes you just have to lift a patient as best as you can, depending on the position that they're in.
Yep. Now, make sure you do a lot of extension exercises where you're standing up, pinning your shoulders back, tucking your chin, working those back muscles to help keep your torso elevated and strong. And because gravity and your work and lifting is pulling you forward like that. That's what puts that disc in a vulnerable position. All right, so what do you think about that adjustment today?
It was pretty strong.
Yeah, pretty strong and different. And we felt movement in there that we hadn't gotten yet.
Yeah.
And that's encouraging. And that's going to get you that next layer
It's
of
like
improvement.
the whole spine cracked at the same time.
Good, bad, yeah.
I mean, it's good.
You might be sore. Okay. So put some crushed ice on the sore spots, stretch. I mean, your muscles got to adapt to that new configuration. That's the whole name of the game. So just like a workout, you get some soreness. Your body's doing something it's not used to doing. Ice it and stretch it. That's how you manage it, just like a workout. Well, good, man. You got any other questions for me?
Nothing.
All right, wonderful. Well, there's your Louisiana car. Oh, don't forget to like and subscribe, by the way. If you like this video content, if you find it informative, informational, please share it with your family and friends. Like, subscribe, share, hit the bell for notifications on our YouTube channel. We greatly appreciate it. This is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.